Hi, I'm Danielle Matias at Caring Medical Florida. Today I want to talk about sternoclavicular joint instability, especially as it relates to the ribs. Now this may sound confusing, like what is the sternoclavicular joint? But actually this is something that I am seeing so much more in my practice with people that come in with shoulder and or rib and thoracic injuries. So I thought it was just really important to go over today. This is a picture of the rib cage. As you can see, here's your sternum. These are all the ribs that are attaching to it. Right up here at the top of the sternum and your clavicle or your collarbone, this is the sternoclavicular joint. So you have one on both sides. Technically, this is considered part of your shoulder. You know, your collarbone comes over, attaches to the rest of your shoulder over here, but it does overlap with the rib cage. So people that have chronic shoulder instability and or the presence of rib instability, especially that first rib or thoracic instability, many times actually do have this condition as well. Not every patient with sternoclavicular instability is going to look like this. It's oftentimes not as pronounced. The sternoclavicular joints are much more flush, but you might get a lot of clicking, popping, snapping, pain. A lot of times if you just put your hand and you kind of do this like chicken wing maneuver, I say, if you get a lot of cracking, clicking at this joint, that can be a sign that that joint is unstable. This patient, we should just know, we did treat with Prolotherapy to the sternoclavicular joint as part of his treatment plan, and he actually is doing much, much better. Sometimes we do consult with other, physical therapists or chiropractors on these cases. Majority of the time, just getting that joint stable, as well as treating the shoulder or the ribs or any other unstable joints that affect it, the patients do get really, really good results. Just to go over even more anatomy. So again, here's your sternum. These are the ribs that are attaching. Right here, this is that sternoclavicular joint. What's unique about this joint is it's not like your knee where you have a meniscus or other kind of thick fibrous tissue that's stabilizing it. This is purely stabilized by just a whole network of ligaments around it. There is a disc in here, but when we talk about like the majority of the stabilizers in this joint, it's very much reliant on these ligaments. So if this ligament is loose, like a stretched out rubber band is kind of flopping or moving more than it should, we really, really have to do a good job of tightening those ligaments to recreate that stability. And you can see here, like this is the first rib that's coming around from the back, wrapping all the way around the front. Here's the second rib. People with first rib instability or first rib issues oftentimes may actually have a sternoclavicular instability as well. Not that they always have to go hand in hand, but you can see like just anatomically they're so closely related. So if you had a trauma, an accident, or even just overuse that's putting a lot of strain here, it's very likely that some of that strain can actually go to the adjacent structures. So when we see a lot of people with first rib instability, which is also becoming much more prevalent and much more seen in this office, again, these two often do go hand in hand. Same thing for maybe someone that's hypermobile. They have joint laxity, ligament laxity throughout their whole body. They, get a shoulder injury, now they have shoulder instability. This is one that we definitely want to evaluate because this can make a really big difference in patient care. Part of the reason that we can, tell if that joint is clicking or popping or cracking when the patient does that kind of chicken wing maneuver that I mentioned is because if you look here, this is the sternoclavicular joint, here's the scapula in the back. When you do things that raise or elevate that scapula up, the sternoclavicular joint is also involved in that motion. So if you're doing, a lot of repetitive motion, you're getting a lot of clicking, popping associated with pain in that sternoclavicular joint, anatomically, it makes sense why that could happen if the joint is unstable. The other joint too, kind of on the other end of that sternoclavicular joint is your AC joint, which is commonly, considered part of the shoulder over here. But again, sternoclavicular, acromioclavicular, they're just kind of like can seesaw on each other as they go through that same collarbone. They share that bone. So if somebody has a very, very loose acromioclavicular joint, they separated their shoulder, overuse trauma, whatever it may be, over time, that chronic instability can start to kind of shunt force over to the front of that chest there. Oftentimes when we see patients in our office with that chronic sternoclavicular joint instability, they've tried a lot of things, physical therapy and chiropractic care, and maybe that's helped them to get some symptom relief, but by the time they get to our office, that condition has not been resolved. And the reason that we find in those cases is because those ligaments are loose, because those ligaments are like stretched out rubber bands that need to be tightened, that need to be healed to recreate that joint stability. If any of this sounds like you or sounds like somebody you know or a patient of yours, please check out our website. We have so much information and research on there that we'd love to share with you.